So we can see in this page, we can see here, there are 8 extraordinary meridian. 1, 2, 3, 4, 5, 6, 7, 8. And every meridian having some name, like the Ren Meridian. The name of Ren Meridian is Ren Mai. The meaning of Mai means vessel. Vessel. So we are telling Ren vessel or Ren Mai, Du vessel or Du Mai, Chong vessel, Chong Mai. Okay, in this way. तो इसे हम रैन बेसल कहते हैं, रैन माई भी कहते हैं. The other name is conception vessel. Okay, what are the functions? We will see one by one. If we talk about the Ren Mai, अगर हम Ren Mai की बात करें, so Ren Mai means conception vessel. There are many other names of Ren Mai. तो 8 हमारी एक्स्ट्राऑर्डिनरी मेरिडियन है, उसमें जो पहला मेरिडियन है Ren Mai, and the many other name of the Ren Mai we can see here, like conception vessel, or we are telling it CB or Ren Mai. So we are telling CB1, CB2, we know all the points, CB3 or Ren1, Ren2, Ren3. So these all points are, whether the Ren1, Ren2, CB1, CB2 means are same, whether you tell CB1 or the Ren1. The other name is controlling vessel. इसी का दूसरा नाम है controlling vessel, or this is also called directing vessel. And also we are telling the sea of yin meridian, कि हमारे जितने भी yin meridian हैं उनका ये महासागर है. कौन? Ren Mai. So Ren Mai is the sea of yin meridian. Very important line, sea of yin meridian. So what is the meaning of that? What is yin? Yin का मतलब क्या होता है? Yin का मतलब है कि हमारी कार का फ्यूल, डीजल, पेट्रोल, that is the yin. If petrol is there, you can drive the car. If petrol is not there, you can't drive the car. In the same way, if we talk about the human body, yin is the fuel of human body. We can do lots of work out of this fuel. हम इस fuel के कारण ही सारे काम करते हैं. Every day we are doing lots of work, then we are sleeping in the night. So when we are sleeping in the night means हम अपनी कार को फ्यूल स्टेशन पर खड़ा कर रहे हैं. We are keeping our car on the, taking our car to the fuel station and refilling the tank. So sleeping in the night means refilling the tank, right? So yin is very much important. Yin very, very important, right? Now, regarding the yin, we can also understand this concept here. Like this is the sunrise, we can know sunrise. And here we can see sunset. Okay, this is the sunset. So during the sunrise, in the human body, the cortisol is very high, very, very high. Cortisol means the natural steroids of the human body, हमारे शरीर का steroid. So during the morning time, during the sunrise time, even before the sunrise time, which is called Brahma Muhurta, the level of cortisol is good. Or during the sunrise, the cortisol level is very high. Steroid is very high. And we know the cortisol is giving us enthusiasm. We can do lots of exercise, we can do workout, we can run, we can build our body muscles. And the best time in the morning, because there is a natural high cortisol. So sunrise के समय cortisol, and when we talk about the sunset, means after the sunrise, exactly after 12 hours, then cortisol level is decreasing and another level is increasing, that is called melatonin. Melatonin, we know melatonin is secreted by pineal gland. तो जब हम गहरी निद्रा में होते हैं तो हमारे बॉडी में कौन सा हार्मोन होता है? मेलेटोनिन. So during the sunset, the melatonin start increasing. Okay, maybe 6 p.m. is the sunset time. The melatonin start increasing, then going high after the 4 to 5 hours, near about 4 hours. It is reaching on the peak. So the high melatonin, near about, suppose 6 plus 4 is equal to 10, 10 p.m. or 11 p.m. The melatonin is very, very high. So this is the cycle. During the sunrise, cortisol is high, or we are telling the high yang is plus plus. And during the sunset, melatonin is high, or we are telling yin plus plus. So this is the cycle of yang and yin. But suppose if person is not sleeping enough, or the having high stress at night time, having high stress at night time, रात को बहुत stress है उसे, then what will happen? There will be increase of cortisol in the night. Definitely, if the cortisol is very, very high, then again melatonin will decrease, yin will decrease. Person will be suffering with yin deficiency because you are stressful. If we are stressful, then cortisol will be higher. Cortisol means steroid, which is secreted by adrenal cortex, adrenal gland, right? So that's why nowadays it's a very common pattern. The people are suffering with a high stress, high steroids, and yin is deficient. Yin is deficient. Yin means maybe not able to sleep, maybe not able to refueling of body. हमारे शरीर को वापस फ्यूलिंग नहीं कर पा रहे. Okay, then what to do? Then person will be suffering with yin deficiency. What are the symptoms of the yin deficiency? Okay, then person will be suffering with the yin deficiency. Person will be suffering with the cooling deficiency. Or the air condition of the body is bad. Air condition system of the human body is in bad condition. हमारे शरीर का जो एयर कंडीशन है वो बुरी अवस्था में है. Then body will not be, if the yin is deficient, then person will be feeling heat, or during hot flashes, okay, or thirst in the night, or dry throat in the night, drinking water again and again in the night, drinking water in the night. क्यों ऐसा हो रहा है? क्योंकि उसके शरीर का एयर कंडीशन वीक हो गया है. यिन कमजोर हो गया तो वो अब ठंडा करने की कोशिश कर रहा है शरीर को। कैसे? पानी पीकर। So we already know the sign of the yin deficiency are, there are many signs. Like one sign is 5 heart heat. 5 heart heat. 5 heart heat means both palm are hot, both feet are hot, and chest is hot. This is called 5 palm heart heat or the 5 palm heat. दोनों हाथ की हथेलियां गर्म, both palm is hot, both palm are hot, both feet are hot, chest are hot. That is called 5 heart heat due to yin deficiency. It's a very common pattern nowadays. ये बहुत ही कॉमन पैटर्न हो गया है क्योंकि व्यक्ति तनाव युक्त है, cortisol is high, melatonin is low, not able to sleep properly. If not able to sleep properly, because sleep is very much connected with yin. Good sleep means good yin. So yin is nourished by sleep. If you want to nourish yin, you have to sleep properly, 7 to 9 hours. Okay. You have to eat properly and reduce stress और cortisol. तो क्या होगा कि रात में आप, जब हम रात को ब्लू स्क्रीन देखते हैं, ब्लू स्क्रीन, व्हाट इज द मीनिंग ऑफ ब्लू स्क्रीन? मोबाइल, लैपटॉप, it also increase the level of cortisol and responsible for yin deficiency. So it's recommended, don't touch any devices at least 90 minutes before sleep. If you want to improve your yin, अगर आप अपना yin improve करना चाहते हैं. So now let's see here. So if the person is having yin deficiency and showing some symptom, then will improve Ren Mai. हम Ren Mai को improve करेंगे. How to improve the Ren Mai? With the help of lung 7 and the kidney 6. Lung 7 and kidney 6. Because Ren Mai is the sea of Yin Meridian. ये हमारे Yin Meridian का समुद्र है. So look at here. If the person is having any problem on the face, any problem on the front part of the body, like chest, means thorax, or the lungs, or the upper and lower abdominal in this front area. Especially, I will tell you, most important thing is abdominal masses. अगर पेट में या pelvis में गांठें हैं, if there is a masses, if there is a nodule, if there is a lump, if there is a fibroid, if there is a cyst, if there is an unwanted enlargement in this part, we will use Ren Mai, because Ren Mai is the control of front part of the body. हमारे शरीर के front part को control करता है. So the person is suffering with the problem, the chest or the lungs or the throat and face or the abdomen, Ren Mai. Okay? तो अगर कोई व्यक्ति especially uterus की problem है, after removing the uterus, we have to give the treatment on lung 7 for sure. अगर यूट्रस निकाल दिया सो अब वहां पर क्या है, पहले यूट्रस था, अब क्या है? प्रीवियसली देयर वर यूटेरस, बट नाउ व्हाट इज देयर? नथिंग. सो बिंड एयर, emptiness. So when this type of patient coming to you, uterus removed, what is the problem? Oh, I'm having knee pain. Oh, you are having knee pain because channels are going, stomach channel, we know the going and crossing the knee also, the passing the uterus and the knee also. So uterus removed means lower abdomen. Uterine fibroid means lower abdomen. Okay. Ovarian cyst, prostate enlargement, some problem in the pelvis. Okay. Upper abdomen problem. A problem in the stomach, in the central line. Chest problem, lung problem, cough and cold, asthma, breathlessness, throat problem, thyroid problem, face problem, any problem in this front part you want to treat, then we'll use the Ren Meridian. Obesity, we can't consider the problem of front part because obesity might be in the buttock area, that is on the back side. Obesity on the breast, the front side, abdomen front side. Obesity is the complete a circle. Okay. So now we are going one by one. Don't worry, we will learn everything. So whether randomly you will not able to understand. कि रेंडमली हम जंप करेंगे कि हाँ एलर्जी पे भी काम करेगा, हाँ इधर भी काम करेगा, तो कंसेप्ट डेवलप नहीं हो पाएगा कि आखिर ये काम कैसे करेगा. सो लेट मी गो स्टेप बाय स्टेप. इवन आई विल गो इन द वेरी डीपर डिटेल दैट हाउ द रेन माइट गो, बट बिफोर दैट लेट्स सी क्विकली. फर्स्ट थिंग व्हिच आई वांट टू टेल यू, पहली चीज जो मैं आपसे कहना चाहता हूं, फर्स्ट थिंग, फर्स्ट स्टेटमेंट, the Renmai is having connection with the anterior pituitary. A very important information. If the problem of the anterior pituitary, you have to treat the Renmai. आपको Renmai को treat करना होगा. We can see this is the brain and this is the anterior pituitary here. Somewhere in the brain, okay, anterior pituitary is there. What is the role of pituitary? Pituitary का role क्या है? So we have to treat the Renmai. Lung 7 and kidney 6 for anterior pituitary. Actually, in the brain that we know, this is the super brain, which is also called hypothalamus, secreting some hormones. They are controlling pituitary gland. They are controlling pituitary gland. Right? So the super brain controlling the pituitary gland. So pituitary gland is called master gland because it controls entire body. And the super brain is called master of master or super master. We can tell super master. Brain is the super master. And pituitary is the master. That's why when the female or male are putting the tilak here, it is purpose to activate pituitary gland. So it is the activation of pituitary gland. Now, the pituitary gland is, suppose this is the pituitary gland. This is the pituitary gland. Now we are telling we have to use the Renmai फॉर पिट्यूटरी ग्लैंड, हमें रेनमाई को ट्रीट करना है, किसके लिए? पिट्यूटरी ग्लैंड के लिए। तो क्या चीज के लिए? वी वांट टू यूज लंग 7 and the kidney 6. Lung 7 on the lung 7 will be the master point, and kidney 6 will be the couple point. And we are telling that we have to use it for the pituitary gland. It means when we can use lung 7 and the kidney 6. Now, please tell me, आपको क्या लगता है? कोई प्रॉब्लम का नाम बताइए। एक स्टेटमेंट दिया है, जब एक्यूपंक्चर में एक स्टेटमेंट लिखा है, it's connected with pituitary gland, anterior pituitary. Now the question comes, what we can treat with lung 7 and kidney 6? Can you tell me? Few problems, few diseases. Tell me, please. You're telling that we can treat thyroid, we can treat PCOS, we can treat growth. Yes. Yes. Anything else? What we can treat? हम और क्या ट्रीट कर सकते हैं पिट्यूटरी ग्लैंड से? Infertility hormone. Yes, yes. Okay, very good, wonderful. I will tell you quickly because maybe some person might not be knowing. So whenever I am telling you, remember, we are talking about lung 7 as a master point, and kidney 6 as a couple point. So we are doing tonification of the master point and sedation of the couple point. Sometimes we can tonify both also. It depends on the condition. हम उन चीजों की बात कर रहे हैं जिन कंडीशन में हम इन दोनों पॉइंट का प्रयोग करेंगे, राइट? So number one, if we talk about the anterior pituitary, which is connected with the Ren Meridian, the anterior pituitary is secreting some hormone like TSH, ACTH, GH, GTH and prolactin. ये हार्मोन सीक्रेट करती है हमारी एंटीरियर पिट्यूटरी. नाउ यू कैन अंडरस्टैंड व्हाट इज TSH. टेल मी व्हाट इज TSH. TSH क्या है? एंटीरियर पिट्यूटरी बना रही है. TSH इज द thyroid stimulating hormone. It means the person is suffering with the thyroid disease. Person is suffering with the increase or decrease amount of the thyroid. We are telling hypothyroidism, overweight, and whatever the problem of the thyroid disease. हम जो भी ट्रीटमेंट करेंगे, but we'll start our treatment with the lung 7 and kidney 6. If the person is having issue of thyroid, because the meaning of TSH means thyroid stimulating hormone. Thyroid stimulating hormone. Okay. So we'll put the lung 7 as the master point and the kidney 6 as a couple point. Okay, thyroid is over. Can you tell me what is the role of ACTH? ACTH means adrenocorticotropic hormone. इसका क्या रोल होगा? और हम लंग 7 का प्रयोग किस पर्पज से करेंगे? Now, if the ACTH, what is the role of ACTH? I will tell you. So this is the kidneys. ये हमारी किडनी है. इसके ऊपर ये जो कैप है, the cap of kidney, which is called adrenal gland. The adrenal gland is having outer part that is called cortex, and the center part is called medulla. We are talking about the cortex, outer part. The outer part make steroids. ये outer part है जो steroid बनाता है, right? So now we can understand when we want to balance the adrenal gland. हमें adrenal gland को balance कब करना चाहिए? If the adrenal gland is overstimulated, adrenal gland overstimulated. Why? Because you are stressful. So body start making steroid, or you are suffering with some infection of the bacteria and virus. जब infection होता है डॉक्टर के पास जाते हैं, वो भी steroid देते हैं. So when during the infection, doctors give you steroid, even body is making the steroids. So during the stressful condition, during the infections, adrenal gland overstimulated and making the steroids. Right? So again, I already told you, if the high steroid, high cortisol, then person will be suffering with the yin deficiency, because it will not allow to have the good sleep. Okay. So we are, as soon as we activate the lung 7, the kidney 6, it will improve the yin and balancing our adrenal cortex. Many times I use ACTH for asthma patient. Asthma patient. Why asthma or the chronic asthma? Because chronic asthma also result of maybe sometimes stressful condition, stress induced, or maybe due to some infection or allergies. So there is a high cortisol in the body, or whatever. When the person is suffering with the chronic asthma, as soon as we work on the ACTH, it's work very nicely. So lung 7 and the kidney 6 are very good for ACTH, for stress and for asthma. आपको ध्यान होगा जब हम ऑरिकुलर एक्यूपंक्चर की बात कर रहे थे, तब भी हमने बताया था कि अगर अस्थमा का आप सिंगल पॉइंट लगाना चाहते हो, यू वांट टू पुट द सिंगल पॉइंट फॉर अस्थमा, that is ACTH, the single point for asthma in the ear, and you will see very excellent result just by the single point, ACTH, adenocorticotropic hormone. निकलता तो हमारी पिट्यूटरी से है, लेकिन एडिनल ग्लैंड पे काम करता है. Right now I can just tell you the information, the ACTH point in the ear, very, very helpful point. Okay, hold your ear like this, you will find it. अपने कान को ऐसे पकड़ो और फिर एकदम बॉटम में चले जाओ. Go in the bottom, hold this tragus and go in the bottom. The inner point is ACTH. Inner point is ACTH. If you press this, it's an excellent point for chronic asthma, right? Even the body, if you activate the ACTH, how to activate the ACTH? How to work on the ACTH? Why? Lung 7 and the kidney 6. तो जब भी कोई व्यक्ति आपके पास बहुत तनाव युक्त आया, अरे बहुत स्ट्रेस हो रहा है, not able to sleep, I'm having too much stress, I'm not able to sleep, I'm having too much stress, I'm having too much workload from my office. Okay, means person is stressful. We have to work on adrenal gland. Even if you, maybe many person are knowing the sujog, if the person is stressful, even in the sujog, if you press the adrenal point, it will be painful. एडिनल ग्लैंड पॉइंट पेनफुल हो जाएगा, और एडिनल ग्लैंड को दबाने से उस व्यक्ति को बड़ा आराम मिलेगा. In the EOV, we are using lung 7, the kidney 6 point, and we are working on ACTH. So that's why it's a very good point for chronic asthma. Chronic asthma. We already told you the lung 7 and the kidney 6 working on the face, throat, chest, lungs. But now we are telling the same thing in a different way because lung 7 working on the ACTH, anterior pituitary. So it's a very good for asthma. So you can understand the same thing in a different way. Yeah, no problem, because if the person is having high blood pressure, it might be adrenal gland is overactivated. तो हाई ब्लड प्रेशर भी तो क्रिएट कर सकती है अगर मान लो आप है ना भागम भाग में हो ऑल द टाइम. Adrenal gland is working more, then it will create lots of steroids. Adrenal gland is overstimulated, results, what will be the results? High blood pressure. Lung 7 and the kidney 6 are a very good point for this purpose also. So we have told you that anterior pituitary means Ren Meridian and growth hormone, GH, growth hormone. So growth hormone, we want to work on the growth hormone. We want to work on the growth. We have to activate the Ren Meridian. What is the role of growth hormone? ग्रोथ हार्मोन का क्या रोल है बताइए. ग्रोथ हार्मोन हमारे लिए जरूरी है क्या? What is the role of growth hormone in our body? If the growth hormone is not good, person will suffer with dwarfism, बोनापन. कई लोग बौने रह जाते हैं ना, कम हाइट. Person will not get good height, good growth. Height of the bone, person will not get height of the bone. तो जब हमारे पास कोई आके बोलता है कि अरे कुछ करो हमारी हाइट बढ़ानी है, हम उसका ग्रोथ हार्मोन बढ़ाते हैं. Whatever treatment you do, maybe you are doing auricular acupuncture, you are doing in the TCM, your target is to improve the growth hormone. That's why if the anterior pituitary gland is good, person is getting good height. So how to do that? Lung 7, the kidney 6. आप lung 7 और kidney 6 पॉइंट लगाइए. अगर किसी की ग्रोथ बढ़ानी है तो lung 7 and kidney 6. So 2 points we have to put. So that is the work of Ren Meridian. ये हमारे Ren Meridian का work है. Then we talked about the GTH. What is GTH? GTH means sexual hormone. GTH. GTH means gonadotropic hormone. GTH. आपने सुना होगा FSH and LH. Follicle stimulating hormone. Who make the follicle? Who make अंडा? फीमेल की बॉडी में जो अंडे का निर्माण होता है, एग का निर्माण होता है, follicle stimulating hormone से होता है. FSH is responsible to make the follicle, and LH is luteinizing hormone, is breaking the follicle. यानी अंडे को तोड़ने का काम कौन करता है? LH. So these two hormones are very much important. We are telling that hormones, if the anterior pituitary is disturbed, if the FSH LH is disturbed, then you can understand there will be lots of problems, lots of hormonal problems. और hormonal problem क्या होती है? Like PCOD, like irregular menstruation. Okay, the many other problems like the menopausal problems. We have to activate lung 7 and kidney 6. तो आपको पता होना चाहिए कि हम lung 7 और kidney 6 को क्यों लगा रहे हैं? Because lung 7 and kidney 6 working on the anterior pituitary, so it's work on hormones, GTH. The finally prolactin. Prolactin means milk hormone. milk producing hormone, दूध बनाने वाला हार्मोन, that is a prolactin. Milk is not coming, or not enough milk is secreting from the breast, so it's due to prolactin hormone or milk secreting hormone. If the milk formation is not enough, what to do? Lung 7 and kidney 6. Sometimes there is unwanted milk secretion also there. Unwanted milk, like maybe some female is not pregnant and not deliver the child. Still milk is coming. ना तो प्रेग्नेंट हुई ना चाइल्ड को डिलीवर किया, तब भी मिल्क निकल रहा है ब्रेस्ट से. There is unwanted secretion. Then also we have to work on this prolactin hormone. Prolactin hormone means PRL. In the short, we are telling PRL. So now you understood. So remember this. Lung 7, the kidney 6 combination is one of the great combination for thyroid, for growth, GH growth, for stress hormone or the asthma I told you, for the milk hormone, for the milk secretion, and what else? Hormones or GTH, hormonal problems. इन सब पर काम करेगा हमारा लंग 7 एंड किडनी 6, राइट? सो लेट्स सी नाउ. अब इसी चीज को हम जरा एक एक करके और देखते हैं. So we can see here, these are the all list of the hormones. ACTH, which will work on the adrenal gland. TSH, work on the thyroid. FSH, LH, work on genital glands. Growth hormone will work on growth, and the PRL will secrete milk from the mammary gland. If you want to improve anyone, lung 7, the kidney 6. कोई भी improve करना चाहते हो, lung 7, the kidney 6. For the male, it will be on the left side. Lung 7, tonification. And kidney 6 sedation on the right side. Because for the male, the dominant side is the left side. Male के लिए जो dominant side होती है, कौन सी होती है? Left होती है. For the female, it will be on the right side. Lung 7 will be on the right side. And kidney 6 will be on the left side. So this is the first line protocol. But the second line protocol also we have to understand here. For the male, we have to add stomach 30 bilateral. And for the female, CV1 bilateral. Suppose you want to work on the uterus of female. Maybe some problem in the uterus. Maybe fibroid. Maybe uterus removed. So we will use the lung 7, the kidney 6, as well as CV1. CV1 play very important role for the female because the uterus is the very important part in the female. So where we are using this combination means lung 7, kidney 6, and CV1. For example, these 4 problems. If you want to improve the yin in the female, अगर आपको female में yin बढ़ाना है, so lung 7, kidney 6, CV1. CV1 will be bilateral. Want to improve the yin in the female. You want to regulate the female cycle. Female की cycle disturb हो गई, right? We will use same lung 7, kidney 6, CV1. You want to work on the indigestion. We will use lung 7, kidney 6, and the CV1 in the female. So let's see here. CV1 for the female and stomach 30 for male. So you want to work for the female cycle. Lung 7, kidney 6, CV1, 1. 2, 3. 2, 3. And you want to work for the male, lung 7, kidney 6, and stomach 30. Why we are using these points? You will understand when we will discussing the route, that how this passing from kidney 1, kidney 2, when you are going to learn, when we learn the roots. But right now, very simple thing. Any problem in the female, okay, hot flushes, lung 7, kidney 6, CV1. Menopausal problem, lung 7, kidney 6, CV1. Okay. The female is telling, okay, I have removed my uterus, now suffering with the knee pain. Oh, uterus removed. Some problem, uterus removed, lung 7, kidney 6, CV1. Oh, I have removed uterus, I am having lower back pain, lung 7, kidney CV1. If any disturbances in this front line, we have to use these 3 points. हमें तीनों पॉइंट को ट्रीट करना होगा. CV1 को हम even मेथड करें. We will do even method of the CV1. Like stomach 30 even method. तो जितने भी पॉइंट्स हैं जो हम अदर देन EOV यूज कर रहे हैं, we will do even method on that. So tomorrow we'll focus a little more on the same concept, that how to work on the chronic asthma, how to work on the fibroid, okay, and many of the problems, how to improve the yin. So now tomorrow also we will continue the discussion on the Ren Meridian. Yeah, we will work on that. आज हमारा ये मतलब, today we wanted to understand the Ren Meridian treating face, throat, chest, abdomen, and the masses of the abdomen, lumps, tumor, cyst of the abdomen, upper abdomen, the lower abdomen. So if anyone complained you, okay, can you treat the ovarian cyst, uterine fibroid, prostate gland enlargement, quickly, oh, mass, lump, nodule, Ren Meridian. Quickly, this thing should come in your mind. Second, today we wanted to learn the Ren Meridian means the ocean of yin. Ren Meridian मतलब हमारे yin का ocean है. मैंने बताया CV1 को हम even method करेंगे. केवल लंग 7 किडनी 6 को टॉन साइडेड करेंगे, बाकी जो पॉइंट्स है उन्हें इवन मेथड करेंगे, राइट? सो द कंसेप्ट इज इनकम्प्लीट टुडे, विल कंटिन्यू द डिस्कशन टुमारो. हम कल इसे कंटिन्यू करेंगे. फाइन, थैंक यू सो मच. लेट्स कंक्लूड द सेशन. सी यू टुमारो.